a physical assessment demonstration, head-to-toe assessment for msn610. I'm Terry Winoker. This is my ID. I'll begin the exam by introducing myself to the patient. Hello, I'm Terry Winoker. I'm a nurse practitioner student, and I'm going to be doing your head-to-toe assessment today. Okay? Can you tell me your name?
My name is Michael Winoker.
And can you tell me your date of birth?
April 23rd, 1966.
So I'm going to wash my hands. General inspection of the patient. The patient appears to be in good health. He's alert. No obvious distress. He's in good, has good hygiene. So first I'm going to give you a series of 3 words, simple words, and I'm going to have you repeat those back to me. Horse, apple, cat.
Horse, apple, cat.
Okay, so at the end of the exam, I'm going to see if you can recall those for me, okay? So I'm going to take your blood pressure. While I'm doing that, I'll put the thermometer into your tongue.
Okay.
Sorry.
Great.
Patient's blood pressure is 118/70. Oops. We'll slip this on your finger. Let's do the other hand. I'm going to take your pulse. Good. Patient's pulse is 62. Respirations are 14. That's still beating. I'm just going to check your pulses while we're waiting. There it goes. Temperature is 97.4. I'm going to just assess your arms here, checking the temperature. Your arms are warm. Brachial pulse. We're 2+ equal bilaterally. Check your radial pulse. Radial pulses are 2+ equal bilaterally. Looking at your fingers. Nail beds are pink. There's no pitting. No cyanosis. They seem to be in good condition. Good. So I'll move this out of the way. So next I'm going to assess your scalp. So just sitting there, I'm just going to examine your scalp. So you can lean your head forward. Patient's scalp is in good condition. There's no lesions or dryness. There's evidence of male pattern baldness. The hair is distributed evenly. Hold your head up a little bit. So I'm going to just palpate your face. Assessing the patient's facial bones. There are no abnormalities. I'm going to palpate your frontal sinuses and your maxillary sinuses. Tell me if you have any tenderness there. Patient has no tenderness upon palpation of the face. Can you make a frowny face for me? And can you smile? Can you puff out your cheeks? Good. Patient cranial nerve 7. Facial nerve is intact. I'm just going to have you close your eyes. I'm going to touch your face with a cotton ball. Tell me when you feel that.
Yes, 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 yes.
Good. Patient has good soft touch sensation of the face. Cranial nerve 5, the trigeminal nerve is intact. So if you can close your eyes, I'm going to examine your eyes now. Just looking at the external eyes, eyelids are smooth. There's no deformities noted. There is a little scar above your eye. Is that from childhood?
Yes.
We'll note that in your history. And can you open your eyes? Both eyes open symmetrically. There's a slight ptosis on the right. I'm gonna have, can you open your eyes for me? Conjunctiva is pink and moist. Sclera is white, slightly reddened, but not abnormal, maybe seasonal allergies there. So I'm going to just examine your eyes with my ophthalmoscope. So if you will, can you focus on that spot on the back wall there? And I'm just going to examine your eyes just a little bit. Okay. Red reflex is visible bilaterally. So I'm just going to use my pen light and I'll have you continue to look at the back wall. Good. Pupils are round, equal, and reactive to direct and consensual light. Now I'm going to have you, do you have corrective lenses in?
Yes, I do.
Okay. With your corrective lenses, I'm going to have you just hold that out a little bit. Can you read the lowest line that you can read?
LTFPH.
Good. Patient vision is 20/20 with corrective lenses. Now I'm going to have you continue to look at the back wall, keeping both eyes open. Good. No strabismus was noted. Cranial nerve 2, the optic nerve is intact. So now what I'm going to do is, with you keeping your head completely still, I'm going to have you follow my pen with your eyes. Okay? Good. Patient was able to follow the 6 cardinal fields of gaze. Cranial nerves 3, 4, and 6 are intact. Now we're going to look at your ears. I'm just examining the external ears. The pinnas are pink. There's no lesions. Tell me if you have any discomfort. No pain with tug test. I'm going to have you stand for me. I'm going to stand just behind you here, and I'm going to whisper a series of letters or numbers and have you restate those.
X14.
Good. We'll try it on the other side.
Six, 7, 9.
Good. Patient was able to complete the whisper test correctly. So just have a seat. We'll continue assessing your hearing. Now I'm going to use the tuning fork. We'll do the Weber test. And for this test, I will place the tuning fork on the top of your head here. Tell me if you can hear it bilaterally or equally in both ears. Okay?
Yes.
Good. Now we're going to do the Ren test. The Ren test, I will strike the tuning fork and place it behind your ear on the mastoid process. Tell me when you can no longer hear it, and I'll move it to the front, and then you'll tell me again when you can't hear it. Okay?
Okay. Okay.
Good. Now we'll repeat on this side.
Okay. Okay.
Good. A Ren test was good results. Air conduction is twice as long as bone conduction. Now I'm going to examine the inside of your ear. Patient's ear canal is pink. There's no excessive drainage or excessive cerumen. I can clearly see the tympanic membrane on the left with a cone of light visible. And then the right, there's a little bit more wax on the side, cerumen, but I can still see the tympanic membrane very clearly with a Nice pearly gray color with cone of light visible. Cranial nerve 8, the vestibular cochlear nerve is intact. So now I'm going to just look at your nose. So just visualizing your nose is central in your face. I don't see any obvious deviations in the septum. Can you just occlude one of your nostrils? Breathe in and out. And then the other one. Good. The nares appear to be patent. Just hold your head back a little bit. I'm just going to examine the inside of your nose just a little bit with the light. Bilateral nares are pink and moist. There's not excessive drainage. Turbinates are visible, but they're not enlarged. Next, I'm going to have you test your sense of smell. So I'm going to present a scent for you, and you just tell me what you smell.
Mint.
Good. Patient was able to identify the scent correctly. Cranial nerve 1, the olfactory nerve is intact. Now we're going to move on to assessing your mouth. So just looking at your lips are a little bit dry, not excessively so. I see no ulcerations. So can you just open the inside of your mouth? Open a little bit. Oral mucosa is pink and moist. The teeth are in good condition. Can you stick your tongue out for me? Say ah. Say ah again. Ah. So, patient has good gag reflex. Tonsils are visible. Uvula is midline and rises midline when you say ah. So can you stick your tongue out for me? Can you just lift it and then move it to the side and the other side? Good. Tongue is pink. No ulcerations or plaques noted. Glossopharyngeal cranial nerve 9 is intact, and cranial nerve 10 is intact. So now what I'll have you do is just, I'm going to examine your throat, your neck here. Can you swallow for me? Good. Cranial nerve 12 is intact. I'm just going to palpate your carotid. And then on the other side. Carotid pulses are 2 plus equal bilaterally. I'm just going to listen with the bell of my stethoscope. Just take a deep breath and hold it. You can breathe out. And then again, deep breath and hold it. Good. No bruits are noted. I'm going to try to palpate your thyroid a little bit better. Can you lean your head forward a little bit? Swallow one more time. Good. Thyroid gland is palpable, not enlarged, no nodes or nodules noted. Now I'm going to palpate your lymph nodes, starting in the back with your occipital, then behind your ear, the postauricular, in front of your ear, preauricular, tonsillar, submandibular, submental, superficial clavicle, cervical, deep cervical, try posterior cervical, and laying your head down just a little bit. And try your supraclavicular, if you can hold your arms up a little bit, your shoulders up. I'm not able to palpate any lymph nodes, which is fine. So what I'm going to have you do now is, if you can sit on the stool, and have you turn around and face the back wall. We're just going to look at your back. Okay. I'm just going to untie the top of your gown here. Visualizing your back, the patient's back looks normal. There's no excessive lesions. The chest rises and falls symmetrically. you have multiple macules and papules noted. All seem to be 2 centimeters or smaller, with the exception of 2 that are probably in the 4 centimeter diameter range. You should always have an annual physical with a good skin exam, at least annually. Do you wear sunscreen?
Yes.
Good. You should always wear sunscreen when you're in the sun, particularly on your back and your scalp. Those are areas that some people forget. So now I'm just going to feel your spine. If you can just lean over just a little bit. Just palpating your spine. There's no evidence of scoliosis. Paraspinal muscles are firm but not excessive. It's going to palpate your costal vertebral angle here. Just tap it a little bit. Tell me if you have any discomfort. Good. There's no discomfort in the costal vertebral angle.
Nope.
So I'm going to just have you take a deep breath. Good. Breathe out. Do that one more time. In and out. Just in and out. Good. Patient has good bilateral lung expansions. I'm going to percuss the back. He raised his arm. Try this side. Good. There's good resonance throughout. I'm going to try to percuss to the level of diaphragmatic dullness. So you just lean over for me just a little bit. Okay, I'm going to try on the other side. Diaphragmatic dullness is at approximately T10, which is a normal finding. So now I'm going to place my hands on your back. When you feel my hands, I want you to say 99.
99, 99, 99, 99, 99.
Good. Tactile premises is even in all areas felt. So now I'm going to listen to your lung fields in the back here. So when you feel my stethoscope, I want you to take a deep breath. Let me know if you have any dizziness or discomfort. Make sure you can see this. Good. Can you lift this arm? Let's take this off. Good. Vesicular breath sounds are heard in all lung fields, and no adventitious breath sounds were heard. So now what I'm going to have you do is I'm just going to have you lie down on the bed here, and I'll help you. I'll move the stool. When you step off, I'll move the stool out of the way. Good. So you can just watch the stuff here. There you go. All right. So we'll just loosen your gown here. Just pull it down here. So I'm just going to continue to assess your chest. So just viewing your chest, I'm just going to watch the rise and fall of your chest. The chest rises and falls equally. I'm going to just palpate a little bit. Tell me if you have any tenderness. No? I'm going to percuss your chest. There's good resonance in all of the areas percussed. So again, I'm going to listen to your chest. So anytime you feel my stethoscope, just take a nice good deep breath. Good. Vesicular breath sounds are heard in all lung fields. Now I'm going to palpate a little bit more. Palpating from the left nipple line to the left sternal border. I'm going to palpate up to the angle of Louis. Okay. Now I'm going to palpate down to your apical pulse, which is about the 5th intercostal space. On the left side, mid-clavicular. I'm going to count your pulse. Patient's apical pulse is 60 and regular. So now I'm going to listen to your heart. We'll start with the aortic area, which is 2nd intercostal space on the right of the sternum. And then the pulmonic area, so left sternal border, 2nd intercostal space. You just breathe normally. 3rd intercostal space, left sternal border is Earth's point. Tricuspid is 4th intercostal space on the left sternal border. Mitral is 5th intercostal space of mid-clavicular line on the left. Okay. I'm going to listen again with the bell of my stethoscope. Again, the aortic. The pulmonic. Erb's point. Tricuspid. And mitral. S1, S2 heard at all locations. No skips, no murmurs, no S3 or S4 noted. So now we're going to just look at your abdomen. Just going to have to get up here just a little bit. Just a visual inspection of your abdomen. Abdomen is flat. I don't see any obvious deformities or bumps. You do have a couple of more of the brown nevi here, like you have on your back. There's one here that's about 2.5 centimeters, 2 to 3 centimeters there. Otherwise, it looks completely normal. I'm going to just listen to your abdomen. Bowel sounds are active in all 4 quadrants. I'm going to just listen with the bell of my stethoscope to the vessels in your abdomen. Listen for the aorta, the renal artery, iliac artery, and then on this side, the renal, iliac. No bruits were heard at those locations. Now I'm just going to percuss your stomach. Let me know if you have any tenderness. Good resonance throughout. I'm going to try to locate your liver, so I'm going to percuss down from your lungs, from the area of resonance to the area of dullness. Have your hand. So if you can place your finger right there. It's right there. Now I'm going to percuss up from tympani to dullness. Good. I'm just going to measure this area. This area should measure between 6 and 12 centimeters, and yours measures 6 centimeters exactly. So you can relax. So now I'm just going to lightly palpate your stomach. Let me know if you have any tenderness. I'm here, I'm gonna palpate your femoral arteries. Deep palpation. Now I'm going to try to see if I can palpate your liver. So if you will, if you can take a deep breath and blow it out for me. Try to relax your stomach. Deep breath and blow it out. Deep breath and blow it out. Good. Liver palpated edges are smooth. There's no signs of enlargement or nodules. Now I'm going to try to palpate your spleen. So again, take a deep breath, blow it out. Again, take a deep breath. Good. One more time. I'm not able to palpate the spleen, so I'm going to try to palpate your kidney. This can be a little uncomfortable, so take a deep breath, blow it out. And again, deep breath. I'm not able to palpate your kidneys. I'm going to go back to your femoral artery. I'm just trying to palpate your ankle node, sorry. Not able to palpate your ankle nodes. Femoral arteries are 2+ and equal bilaterally. So now we're going to move on to your legs, your lower extremities. I'm just going to palpate these areas. Tell me if you have any tenderness, joint soreness. No? Good. I'm going to check your pulses, your popliteal. There's no pretibial edema. I'm going to do your posttibial. Sorry, turn your ankle over a little bit. And your pedal. Pulses are 2+ bilaterally and equal for all areas tested. So now I'm going to have you, we'll check your range of motion of your legs. If you can bend your knees for me. Just be careful, I have all this stuff here. Good. Can you stretch your legs back out? Can you point your toes up and then point them down? Good. Are you able to cross your legs and cross the other way? Very good. Okay. Again, can you bend your knees? And I'm going to try to, I want to have you try to resist my pushing. So try to push them down. Good. And I'm going to try to push them in. Good. Stretch your legs back out. I'm going to try to push your feet up. Don't let me. And I'm going to try to push them down. Good. Very good. Patient resistant range of motion is within normal limits for the areas checked. So now I'll have you turn around and I'll have you sit up on the bed again. Sorry. I'll hold your gown for you. Top this a little bit. Okay, it's good down just a hair. Good. Okay, so continuing on, I'm going to have you check your range of motion of your arms. If you can raise your arms up to the sky and then put them down. Good. Can you do this? Good. Cross your arms. I'm going to try to pull them apart. Don't let me. Good. I'm going to try to push them. Good. Do your fingers like this. Can you make this? Good. I'm going to try to pull your fingers, pull them down a little bit. Try to pull them apart. Good. Can you squeeze my hands? Good. Grips are good, equal bilaterally. Range of motion is good for upper extremities with resistance within normal limits. So now what I'm going to do is we're going to try to check your light and dull sensation using a safety pin. So this is sharp. Can you feel that? Mm-hmm. This is dull. So I'm going to be touching you. Close your eyes and you tell me what you feel. Okay?
Mm-hmm. Sharp. Dull. Sharp. Dull. Or sharp, rather.
Okay.
Sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull. Dull.
Good. Patient was able to distinguish sharp and dull for all dermatomes tested. And again, similar to what we did to your face, I'm going to use the cotton ball. I'm going to touch your skin and you tell me when you feel it. Just close your eyes.
Yes. 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 Yes.
Good. Patient was able to distinguish soft touch for all areas checked. So now we're going to look at, try to get your reflexes. So I'm going to start with your brachial here. So if you can just relax your arm as much as possible. Slight reflex. So I'm going to have you just relax here and we'll try the tricep. Just let your arm go limp. Good. Good. And then on this side, this is the arm you had surgery on.
Mm-hmm.
We'll note that in the history. Again. Good. Relax your arm. Again. We'll try the tricep over here. Good. Great. Now, popliteal. And then the other one. Good. Then I'm going to try the Achilles. A little trickier. And then the other one is so good. Reflexes are 2 out of 2 for all reflexes tested. So now what I'm going to have you do is stand. So if you can, we'll check the range of motion of your cervical spine. So if you can look down, good. Look over to your left shoulder, then your right. Good. Can you put your right ear to your shoulder, and then the left ear to your shoulder? Good. I'll have you bend at the waist. I'm trying to get out of your way. Sorry. Good. Stand up. Bend to the right, and then to the left. Keeping your hips completely straight. I want you to twist left, and then twist right. Very good. I'm going to have you walk toward me on your tiptoes. Very good. And you can turn around and walk back on your heels, if you will. Very good. All right, turn around. We're almost done. I'll have you sit. You hold out your hand for me and close your eyes. So I'm going to place something in your hand and you tell me what it is.
A pen or pencil?
Okay? And then keeping your eyes closed, we'll try another.
Glasses.
Very good. Okay, so now can you remember the 3 words that I told you at the beginning?
I believe so. Horse, ball, cat.
Very good. Can you tell me the date for today?
It's December 1st.
Good. Can you tell me the name of the president for the United States?
President Trump.
And who was the man that was just elected president?
Joe Biden.
Very good. That concludes your head-to-toe physical assessment. My recommendations for you is to have an annual physical exam, particularly paying attention to your skin. You need to have an annual skin exam. You have several nevi that you need to observe at least annually. And make sure you wear sunscreen whenever you're out in the sun or protective clothing. Okay?
Okay.
That concludes our head-to-toe assessment. Thank you very much.